push for single-payer health care right here in the U.S.
Single payer! Now!
California and others are saying maybe we should adopt the European.
In 2024, the United States spent over $4.5 trillion on healthcare. That's more than the entire economy of Germany. It breaks down to nearly $13,000 for every single person. And yet, millions of Americans are still skipping treatment because they simply can't afford it. Families are drowning in medical debt, and prescription drugs often cost 10 times more than in other developed countries. So how did the wealthiest country on earth end up with one of the most expensive, confusing, and unequal healthcare systems in the world? In this video, we're pulling back the curtain on the hidden forces driving up costs and exposing who's really profiting from America's health crisis. If you find this eye-opening, make sure to hit that subscribe button and turn on notifications. You won't want to miss what's coming next. In 2024, the United States spent more than $4.5 trillion on healthcare. That's close to 18% of the entire GDP, making it the most expensive healthcare system in the world by far. To compare, most high-income countries spend between 8% and 11% of their GDP on healthcare. Even countries with universal coverage, like Germany, Canada, and the United Kingdom, spend significantly less, yet still manage to insure every citizen. On a per-person basis, the difference is even more striking. Americans now spend about $13,000 each year on healthcare, compared to around $6,500 in Germany, $5,900 in Canada, and just $5,000 in the United Kingdom. That's double, sometimes triple, what others pay, and it's not for luxury-level treatment. You might think this massive spending buys better results, but that's the paradox. The U.S. pays the most, yet often ranks among the worst in key health outcomes. Life expectancy in the U.S. is about 76 years, while people in Japan, Switzerland, and Australia routinely live to 82 or older. The U.S. has higher infant mortality rates, more avoidable hospitalizations, and worse outcomes for chronic diseases like diabetes and heart conditions. So what exactly are we paying for? A significant portion, some estimates say as much as 25 to 30%, goes toward administrative overhead. That includes billing departments, insurance paperwork, claims processing, coding, and compliance. In short, the cost of keeping track of the costs. That's not money going toward doctors, nurses, or patient care. It's bureaucracy. There's also the issue of pricing variation. A simple medical procedure like an MRI can cost $400 in one city and over $3,000 in another, with no clear reason other than opaque negotiations between hospitals and insurance companies. There's no fixed price list. Patients are often completely unaware of costs until the bill arrives. Meanwhile, many other developed countries use centralized systems to negotiate costs with providers, drug manufacturers, and hospitals. That brings consistency, lower prices, and broader access to care. But in the U.S., healthcare is a marketplace with thousands of private players, limited regulation on pricing, and no unified system to keep costs in check. This fragmented model rewards profit, not efficiency. And despite all the spending, over 26 million Americans remain uninsured, while millions more are underinsured, meaning they pay for coverage but still can't afford care. In the U.S., healthcare costs are driven up by one powerful force: middlemen. Insurance companies, billing departments, and administrative layers are at the center of a web of inefficiencies that keep prices inflated. It's a system built on complexity, where the more confusing and fragmented the process, the higher the costs. Take insurance companies. There are hundreds of private insurers in the U.S., each offering different plans with varying levels of coverage, deductibles, premiums, and networks. And every single one of them requires a separate, complicated set of paperwork to process claims. This is where a huge chunk of healthcare spending goes, not toward improving care, but toward navigating the administrative maze. In 2024, estimates suggest that administrative costs account for up to 30% of U.S. healthcare spending, about $1.3 trillion. To put that in perspective, the OECD average for administrative costs in healthcare systems is just around 2% to 3%. Countries with single-payer systems, like Canada and the UK, keep overhead low by centralizing processes, negotiating directly with providers, and handling billing through a single government entity. In contrast, the US has private insurance companies handling everything from claims processing to coverage disputes, each with its own system, fees, and operational costs. That means hospitals and doctors must hire entire teams just to navigate insurance networks and get reimbursed. The problem gets worse when it comes to medical billing. A study by the American Medical Association found that the average US doctor spends $85,000 a year just on administrative costs related to insurance claims, money that could be spent on actual patient care. The complexity of insurance networks means that a doctor might have to bill several different insurers for the same procedure, each with different rules, reimbursement rates, and timeframes. This system requires a huge amount of time and resources to manage, driving up the cost of care. But the real kicker comes when patients receive their bills. In the US, many patients are completely unaware of how much they will pay until after they have received treatment. Hospitals often don't provide transparent pricing, and the bills can be filled with confusing codes that patients can't decipher. In 2023, nearly half of Americans reported receiving surprise medical bills, often for services they thought were covered by their insurance. For instance, a patient might visit an in-network hospital but unknowingly receive care from an out-of-network specialist. The result? A surprise bill that can reach thousands of dollars, even if the patient did everything right by going to a hospital in their insurer's network. Take the example of Tom, a 45-year-old in New York, who went to the emergency room for severe back pain. He was told by the hospital staff that his visit would be covered by his insurance plan. But when the bill arrived weeks later, it included charges from an out-of-network radiologist, totaling $2,500, a cost that wasn't covered by his insurance. Tom was shocked. He spent weeks trying to sort through insurance forms, hospital bills, and confusing jargon. Ultimately, he was stuck with $1,500 of the total bill, despite being insured. This administrative bloat doesn't just affect patients like Tom, it affects the entire healthcare system. A study from the Harvard Business Review estimated that the US spends $500 billion annually on unnecessary administrative costs related to insurance and billing. That's money that could be spent on preventative care, improving medical technology, or directly addressing health outcomes. Instead, it goes into a system that benefits from confusion and complexity. While other countries with single-payer or universal healthcare systems have lower administrative costs, sometimes as low as 1% to 2% of total spending, the US has created an industry around navigating confusion, not delivering care. Insurance companies and billing systems are a major reason why healthcare in America is so expensive and inefficient. One of the most frustrating aspects of US healthcare is that no one knows what anything costs until they get the bill. In most industries, consumers are able to compare prices before making a purchase. You can easily compare the cost of groceries, clothing, or even home repairs. But in healthcare, the prices are shrouded in mystery, and by the time you see the bill, it's usually far more than you expected. A major reason for this is the lack of price transparency. Hospitals and insurance companies rarely provide upfront costs for medical procedures, meaning patients are often left guessing. Studies have found that over 80% of Americans have no idea how much their care will cost until after the treatment has been provided. Even more troubling, the prices for the same service can vary dramatically depending on where you are or which hospital you visit. For example, a CT scan at one hospital in New York can cost anywhere between $1,000 and $3,000, while the exact same scan at a different facility might cost as little as $400. There is no clear reason for these wild variations other than the lack of price regulation or negotiation. When patients are faced with emergency situations, they have no choice but to accept whatever price the hospital sets. They can't shop around, and the prices are almost never made clear ahead of time. This lack of transparency isn't limited to routine procedures. In fact, it's especially problematic when it comes to emergency care. Consider the example of the $10,000 aspirin, a notorious case that shocked the public when a patient in the US was charged that amount for a single aspirin while in a hospital. Or the $3,000 emergency room visit for a routine checkup when the patient had to get care after a minor accident, but had no idea how much they would pay until the bill arrived. This practice is not only confusing, but also incredibly costly. According to a 2019 study by the Healthcare Cost Institute, the average price variation for a routine procedure like a colonoscopy in the US can be as much as $2,000 depending on the hospital. And when patients aren't informed of costs up front, many end up with surprise medical bills, sometimes for thousands of dollars they never anticipated. In 2023, 1 in 5 insured Americans received a surprise medical bill, leading to debt, stress, and financial hardship for families already struggling with rising costs. Internationally, many other developed countries offer a stark contrast. In the UK, for example, most medical costs are covered through the NHS and are provided at no cost to the patient at the point of service. In Canada, prices are regulated by the government, so everyone knows in advance what their care will cost. In the US, however, this lack of transparency benefits the middlemen, insurance companies and hospitals, who can charge whatever they like with little accountability. It's a system that makes healthcare unpredictable and expensive. When it comes to prescription drugs, Americans pay more than anyone else in the world, sometimes dramatically more. The average cost of medication in the US is nearly 2.5 times higher than in other developed countries. For millions of people, that means choosing between life-saving medication and paying rent. Take insulin, a critical drug for people with diabetes. In the US, a vial of insulin can cost $300 or more, even though it costs just $6 to produce. Most patients require multiple vials each month, driving their costs into the thousands. In Canada, the same insulin costs about $30. That's a tenth of the price. And Canadians aren't getting lower quality medicine, they're getting the exact same product from the same manufacturers. So why is the US paying so much more? One major reason is that the US government does not negotiate drug prices. In many countries, government-run healthcare systems negotiate directly with pharmaceutical companies to set fair prices. But in the US, Medicare is legally prohibited from negotiating prices with drug makers, thanks in part to intense lobbying from the pharmaceutical industry. This gives drug companies the power to set their own prices with little oversight or accountability. The result? Skyrocketing costs that hit patients and taxpayers alike. According to a report from the House Committee on Oversight, the top 14 drug companies made $100 billion in profits in 2022, while charging US patients significantly more than those in other countries for the same medications. It's not just insulin. The EpiPen, a life-saving device used to treat severe allergic reactions, saw its price jump from $57 in 2007 to over $600 by 2016 for a 2-pack. After public outrage, the company behind it offered a generic version for $300. Then there are cancer drugs, which often carry 5-figure price tags. For example, the leukemia medication Gleevec costs about $2,500 per month in Canada. In the US, the same drug can cost $10,000 or more per month. That's not a typo. And these aren't rare cases. They're the norm in a system where drug pricing is driven by profit maximization, not patient needs. Another factor, patent laws and exclusivity periods, which allow pharmaceutical companies to block generic competitors for years, even decades. This keeps prices high, even when cheaper alternatives could exist. The consequences are real. A 2023 study by Gallup and West Health found that nearly 1 in 5 Americans either skipped doses, cut pills in half, or didn't fill a prescription at all because of cost. That's not just a healthcare problem, it's a national crisis. In other countries, access to affordable medication is considered a public good. In the US, it's treated as a market opportunity and one that generates billions for big pharma while leaving patients behind. In many parts of the world, hospitals exist to serve communities. In the United States, many operate as profit-driven enterprises, and that fundamental difference helps explain why costs keep rising. Over the past 2 decades, American hospitals have undergone a quiet but powerful transformation. Private equity firms and large health systems have steadily bought up independent hospitals, clinics, and physician groups, creating consolidated networks that dominate entire regions. This isn't about expanding care, it's about maximizing profits. In 2023, more than 70% of U.S. hospitals were part of large health systems. And within those systems, pricing power becomes centralized. When one company owns all the hospitals in a region, they can set prices without competition, similar to how monopolies operate in other industries. This consolidation isn't just affecting prices, it's affecting care itself. A study published in Health Affairs found that hospital mergers consistently lead to price increases of 12% to 25%, with no measurable improvement in quality or outcomes. The market power of these consolidated hospital groups allows them to negotiate higher rates from insurers, which then pass those costs to patients through higher premiums, deductibles, and out-of-pocket bills. Private equity firms are also playing a bigger role. These investment groups aren't in the business of healing, they're in the business of flipping assets for profit. They typically acquire struggling hospitals or clinics, cut costs, ramp up high-revenue procedures, and then sell the business for a profit within 5 to 7 years. According to a 2021 report by the Peterson KFF Health System Tracker, private equity investments in healthcare more than tripled from $41 billion in 2010 to over $120 billion in 2020. That number has continued climbing. What does that mean for patients? In many cases, the result is overcharging and overtreatment. Hospitals now have strong financial incentives to run more tests, perform more procedures, and bill at the highest rates possible, even when it's not medically necessary. That's not a conspiracy theory, it's basic business strategy in a system that rewards volume over value. For example, patients undergoing the same surgery at 2 different hospitals might be billed wildly different amounts. A joint replacement can cost $20,000 at one hospital and over $75,000 at another, even within the same city. Hospitals in monopolized markets, where there are fewer alternatives, charge more across the board, from overnight stays to common lab tests. And hospital markups are no joke. A 2017 study found that some hospitals charge up to 10 times their actual cost for services. In one infamous case, a Florida hospital billed a patient $15,000 for a urine test that cost the lab only $100 to perform. Why? Because they could, and the patient had little power to challenge it. Even nonprofit hospitals, which are supposed to prioritize community health, often operate like corporations. Many earn substantial profits while still enjoying tax-exempt status, all while suing low-income patients for unpaid medical bills. According to a 2022 Loan Institute report, over $18 billion in tax breaks went to nonprofit hospitals. Yet many failed to provide adequate community benefits or charity care in return. The hospital system in the U.S. is no longer just about healing, it's about revenue optimization. As consolidation continues and private equity expands its influence, the line between healthcare and corporate strategy gets blurrier, and patients are left to pay the price, often quite literally. The U.S. healthcare system isn't just expensive on paper. It takes a real, measurable toll on millions of lives every single day. While headlines talk about trillion-dollar spending, the most devastating impact shows up in households across the country, in the form of crippling debt, delayed care, financial stress, and shattered security. Start with the numbers. As of 2023, more than 100 million Americans, nearly 1 in 3, were burdened with medical debt, according to a KFF Health News investigation. That includes people with insurance. The average medical debt in collections is around $2,500, but many families owe far more. For lower-income households, a single emergency room visit or unexpected diagnosis can wipe out years of savings. This kind of debt doesn't just affect credit scores, it delays critical decisions. 1 in 4 Americans say they or a family member have skipped or delayed necessary medical care in the past year because of cost. That includes doctor visits, surgeries, prescriptions, and even follow-ups after hospitalizations. And the effects are compounded when insurance doesn't deliver. Premiums for employer-based health plans reached an average of $23,968 per family in 2023, according to the Kaiser Family Foundation. Employers pick up a significant portion, but workers still pay an average of $6,575 out of pocket, and that's before co-pays, deductibles, or uncovered expenses. This system doesn't just strain individuals, it puts pressure on businesses too. Small employers face hard choices when it comes to offering health coverage. Rising premiums cut into wages, hiring budgets, and investment in growth. In a global economy, that's a competitive disadvantage. But beyond the stats are the human stories. A 39-year-old teacher in Texas recently shared how she delayed cancer screening for over a year because of a $1,200 deductible. By the time she finally had the test done, the cancer had progressed. She now faces not only the physical toll of treatment, but tens of thousands in medical debt, despite having insurance. And she's not alone. These stories are far too common. Medical debt is now the leading cause of personal bankruptcy in the United States. That means healthcare costs don't just threaten health, they threaten livelihoods. Families are making impossible choices. Do they pay for prescriptions or keep the lights on? Schedule that specialist appointment or cover their child's tuition? The stress this creates is immense. A 2022 Gallup poll found that 38% of Americans say they or a loved one has experienced significant emotional distress due to healthcare costs. That's not just inconvenience. That's anxiety, sleepless nights, and constant fear of financial collapse from a single medical crisis. And the burden is not shared equally. Low-income households, communities of color, and rural populations bear the brunt of the damage. In parts of the South and Midwest, hospitals are closing, insurance coverage is weaker, and options are limited, leaving people even more vulnerable. Ultimately, the high cost of U.S. healthcare isn't just a financial issue, it's a national emergency affecting productivity, mental health, family stability, and basic human dignity. And while the system continues to generate billions for insurers, pharmaceutical companies, and hospital executives, everyday Americans are the ones paying, often with money they don't have and outcomes they can't afford to ignore. The U.S. spends over $4 trillion a year on healthcare, yet tens of millions still struggle with debt, delayed care, and poor outcomes. We've seen how inflated prices, corporate consolidation, and lack of transparency fuel a system that puts profits before patients. So here's the deeper question. Is healthcare in America a basic right or just big business? Let us know what you think in the comments. Share this video if it hit home, and check out our next episode to see how America's system compares globally.